value home.
And good morning. Here we are again. It's Tuesday. It's around that time of the day, around 10:30 hour. So you already know what time it is. It's also the month of October. So you already know what we do within the month of October with this show right here. We tend to join ourselves, lend our platform for the cause as well, because it's cancer awareness. And of course, when you talk cancer awareness, who else but to have the awesome and amazing, talented, committed, there's so many adjectives you could add onto her name, because she is, she really does go beyond her call of duty. She's very passionate about women's health, especially breast health, cancer. She's doing so much. Dr. Tamara Remy is our guest this morning. So we're going to come back in a minute and we'll start the conversation. But of course, we must thank our sponsors, which is Quartz, Unicoma St. Lucia, Court St. Lucia, and also the First National Bank. So we'd like to thank you guys so very much for coming on board and putting your backing behind us. We'll be back.
It all started with a penny. For over 85 years, we have invested in our farmers, fishermen, people, and our country. When we were called to serve, we were here. We understand what is valuable to our people and our country. That is why we support all industries, including tourism. We are the bridge towards a brighter future and economic growth. When our people, government, and businesses called upon us, we were here. 85 years later, First National Bank St. Lucia Limited is here for you.
Are you ready for the biggest shopping event of the year? Get ready for Quartz Prime Week Mega Sale, Monday, October 16th to Friday, October 20th. Join us for unbeatable deals. Save up to 40% off on all electronics, furniture, and baby products. And save 35% off on all mattresses and 20% off on small appliances and more. But remember, this sale won't last forever. Prime Week is here, and for a limited time only. Monday, October 16th to Friday, October 20th. Shop now. Pay nothing till January 2024. Don't wait. Don't miss out on Quartz Prime Week Mega Sale. Check in store for details. Quartz, bringing value home.
Well, here we are. Right. Absolutely. We're ready to kick off. Thank you again, Quartz and First National Bank. Dr. Tamara Remy. We are also live on our YouTube channel by now. I guess everybody would have subscribed and you would have turned on your notifications. So whenever we hit the live button, you'll be getting those notifications. If you have not yet done so, now is a good time to do it. And do us a favor and share up the live as well. All right. So we're live over on YouTube. It's different now. We're no longer on Facebook. We're live on YouTube. So please share it with us. Dr. Remy, good morning. Good morning, and welcome. Welcome.
Thank
of
you.
course, we always, and you might need to come a little closer to my mic. I don't know. Yeah. Because you're so soft-spoken, you're not loud like me. Morning.
Good morning.
It's
Thank
a
you for
pleasure.
having me.
Oh, it's always a pleasure.
Always.
And like I mentioned in my preamble, certainly when we think about cancer and we think about the month of October, certainly you come to mind, because even outside of this month, you're doing so much, you're always there. We can always hear you advocating for something along that line. So it does resonate with us how passionate you are about this. So, whenever this month comes around, we always feel so privileged, and we feel that, we owe it to ourselves and our listeners to rope you in, so you could continue to remind us, as to, the needs and some of the things that we could just probably be skipping over, in ignorance, really, but here we are again. And I wanted to talk to you because we had you here before, so we know about you. We know about Dr. Tamara Remy. So this time we want to just circulate the conversation around the awareness and everything that you have been doing, your establishment have been doing. You are the president of the St. Lucia Cancer Society.
Yes,
Present,
I am.
right. Plus you hold so many other hats
Yes,
in that
I
field,
do.
and then you even go beyond the call of the hats that you hold, because what drives that passion? Why are you so passionate about this?
I think certainly from my training in Jamaica during residency,
Right.
I always felt that being one of the few female surgeons, that there was a different kind of connection with the female patients, especially when it came to breast health and breast cancer.
Okay.
Not knocking the male surgeons out there, but I think when you see a patient, just in general, but certainly female patients who are now faced with this diagnosis or something that might be a precancerous lesion, it strikes you that this person is like you, a mother,
Right.
you know, a sister, has a certain place in a household, in a community.
Yeah.
And I think being able to understand that allows you perhaps to be even more nurturing and more empathetic and
Yeah.
more supportive. And I've always found myself, apart from the fact that I like breast disease and I like treating patients with breast cancer, just the disease, the organ itself, the breast, that it makes it so much easier. It takes nothing out of me, really, to do that. When I graduated, I always found myself working with different entities, whether it's to help with the awareness or to assist with breast cancer screening. And when I came back home, my first move was to go to the Ministry of Health to just find out, well, what's happening with cancer here.
Right.
It worked out that at the time, the past president, Dr. David Bristol, was looking for somebody
Right.
to hand the reins over to.
Right.
And although I hadn't heard too much about the St. Lucia Cancer Society, I was like, okay, maybe this is an opportunity to do something and to make something of it and the awareness. So it's something that I'm extremely passionate about. And people who know me would understand that if I could do this full time, I probably would. But at the moment, it's all volunteerism. And like I said, I think the most driving thing is, although I'm finding it difficult to see significant change in terms of the early diagnosis and perhaps even the outcomes, I'm feeling like I can almost feel something is going to happen soon.
You're hopeful.
And yeah, I'm very
Right.
hopeful. And especially this year, for some reason, I know that entities like ourselves, like Faces of Cancer and even the Ministry of Health, we do our things individually, and we do make a big thing of Breast Cancer Awareness Month in October. For some reason, I have found that this year there has been an extra movement in
Right.
bringing that
Okay.
awareness.
Nice.
And I just feel like, okay, everybody's kind of on board. So, for
Yes.
example, when I write to different companies, and I say, okay, can you go pink with us this month? They're like, okay, we've been asked to do that as well. And so
Yeah.
it's almost like you're reinforcing what's already happening.
Right.
So there is some hope in terms of the awareness, but we need to translate that now into actually making a dent in the numbers of the cancer cases that we're seeing every year.
Wow. You've been the president for how long?
5 years. This is my 5th year. I took a
This is
break
your
from
fifth-
being the
right.
president last year.
Right.
I was still on the board, but 5 years, just
5
about
years.
5 years.
Right. Now, let's talk in terms of stats. I'm not sure if you have these all, because there's so much stats to keep in your head.
Right.
But in terms of, like, you can give us a little roughings as to, in terms of stats. You talk about the numbers. Let's talk about the numbers whilst you were there holding on that rein. And then we definitely need to come and spend some time in terms of, like you said, the early diagnosis and stuff
Right.
like that, to let people understand how critical, how life-changing of a difference it could make
Right.
if we start adopting that attitude. Because you know what, we here, we're not affected, so we just living life and you're going along, and you never know, and then
Exactly.
boom, you have to really break this down in real terms for us as to how critical, how serious, and how sudden this thing could happen.
Yes.
In the blink of an eye. So you cannot slide through and tell yourself, well, I'm off the hook,
Exactly.
this kind of way. So let's talk in terms of stats, numbers wise.
So the figures that we have, and we're still compiling. So every year we collect data.
Right.
And we're looking at, in total, for cancers, not just breast cancer, we're looking at between 250, 300 cases a year. Okay? Of which maybe 50 to 60 are breast cancer. So in St. Lucia, like a lot of places globally, breast cancer is the number one female cancer.
Right.
Okay. In a lot of our middle to low income countries, it's also the number one cause of cancer related deaths in females. Okay, so that's the importance there. When we look at the deaths from cancer in general, if we're diagnosing maybe 250 new cancers every year, we're also seeing maybe 250 deaths. But that's not the same cancers that we've just diagnosed in that year.
Right.
Okay, and there are a lot of things contributing to that.
Right.
Female cancers, and as I mentioned before, if you think of the female and her role, okay, is central. So when you have somebody, a woman being diagnosed with breast cancer, it means she can no longer function as the center of a household in terms of work and all of those things. And so while, yes, the numbers indicate that it is the number one cancer among our females, and our females make up almost half of the population.
Exactly.
Okay, so we're talking about half of the St. Lucian population.
Right.
We also have to see the ripple effect of how that affects society. So kids being able to go to school, being able to function at school, those are all important factors. When you get diagnosed with cancer, and we'll talk about the signs, the symptoms, etc., it's not something that you can come to the hospital and in 5 days you're cured and you get to go home and that's it. Right. The diagnostic process takes a little while. We try as much as possible to minimize the number of days or that you wait between feeling a lump, getting a test done, getting your biopsy done, and getting your results. That can actually take a week.
Wow.
Okay, which is good compared to what used to happen before.
Right.
But once you get diagnosed, you now have to see yourself for the next 6 months to a year undergoing treatments. And so you have to find the money up front. You have to undergo either the surgery first or the chemotherapy or anything else. So we're talking about a female being kind of out of her normal function for 6 to 8 months, sometimes even longer than that. And so from a production, in terms of, if we talk about government, if we talk about work and productivity, that's significant. Again, we're talking about women who are in society and working. So the figures suggest that there's still the majority of women who will get breast cancer over the age of 50. So we're talking about 2/3 of those women. We are seeing an increase in the number of younger women who are getting breast cancer. And we're talking about sometimes 20-something-year-olds who we would definitely not be thinking would have breast cancer. So how we approach any woman who has a breast lump or something going on with their breast is also changing in recognition of that. But the figures still suggest that the majority are 50 years and older. Again, good time to mention that while we speak about the females, men can get breast cancer.
Oh, I met one on the weekend.
Oh, really?
Yes, I met a gentleman who was affected by it. He's good. He's doing well. Good, great spirit. He's upbeat and all of that.
Exactly.
You know, he was doing something. I think he's part of the volunteer of the Faces of Cancer as well. Yes, so I met him on the weekend.
Oh,
and
nice.
I was like, oh, yes. Because
Yes.
normally we just say female. We tend to have that mindset.
Exactly.
But, you know, interestingly, men
They
can
do,
affect the
right? It's rare, but they do. So they present the same way, and their treatment is just about the same as for females.
Right.
The point I think most people need to recognize is your family history of having had or having breast cancer only accounts for 10% of our breast cancer diagnosis. Okay, so the same way you were mentioning that, you know, I'm sitting pretty, I don't have anybody in my family who has cancer, so therefore I'm unlikely to get cancer. Right. We need to change that. So again, 90% of us who will get breast cancer will have no family history. Okay, it's what we call sporadic. Now in St. Lucia, like a lot of our Caribbean neighbors, we don't do a lot of genetic testing. But just from speaking to patients, we know that there's lots of close relatives who have cancer. There's probably something genetic. So in those patients who come from a strong family history with a background of cancer, we definitely put you in a high-risk group. You are likely to be at a much higher risk for getting cancers, whether it's the breast cancer or the others. We've been kind of working with Martinique to have a program to do some genetic testing. That's at OKEU. And we're hoping that can actually continue.
It has to be done.
We take the samples here, but Martinique cannot. Yes, so we send it off to Martinique and then to France.
So you're trying to get it to be able to do.
We have had that program, and as of September, I think we've been trying to continue it.
Lovely.
So it was for, I think, a 2 or 3 year period of time.
Nice.
And in select patients. So there's a lot that's going on. But when we talk about the 90% of us as women who may get breast cancer,
Right.
there are a lot of things we can actually do to prevent it. And there are a lot of things we can do to diagnose it early. Okay?
Okay.
So
let's go. I want to do that.
Sure.
Let's just now take a break though.
Okay.
Let's acknowledge our partners, and then we'll come back and we'll talk about that part of it, because I think this one is a very important part where we're heading now. Guys, let's take a break. We're coming right back. Yolinda, it's good to see you as always.
It all started with a penny. For over 85 years, we have invested in our farmers, fishermen, people, and our country. When we were called to serve, we were here. We understand what is valuable to our people and our country. That is why we support all industries, including tourism. We are the bridge towards a brighter future and economic growth. When our people, government, and businesses called upon us, we were here. 85 years later, First National Bank St. Lucia Limited is here for you.
Are you ready for the biggest shopping event of the year? Get ready for Quartz Prime Week Mega Sale, Monday, October 16th to Friday, October 20th. Join us for unbeatable deals. Save up to 40% off on all electronics, furniture, and baby products. And save 35% off on all mattresses and 20% off on small appliances and more. But remember, this sale won't last forever. Prime Week is here, and for a limited time only. Monday, October 16th to Friday, October 20th. Shop now and pay nothing till January 2024. Don't wait. Don't miss out on Quartz Prime Week Mega Sale. Check in store for details. Quartz, bringing value home.
And for those of you who are just joining us on She Speaks, if you're joining us via our frequency or you're on the website, you've downloaded our app and you got it on a smartphone, or you've taken up the privilege or the advantage of viewing us on our YouTube channel, well, we're here with Dr. Tamara Remy, who is the president of the St. Lucia Cancer Society. She is a surgeon. She's got a lot of titles, but it's the month of October, so certainly we have roped her in her capacity in her relation to cancer, breast cancer more importantly right now. We were about to talk about early diagnosis and science and prevention.
Right.
You said prevention. Can you really prevent?
So
You could try to minimize.
Right? Exactly. So the figures, again, as things evolve,
Yeah.
we get more encouraged.
Yes.
Right? So I'm sure 50 years ago it was, well, there's nothing I can do that's going to stop me getting cancer. And
Right.
to a certain extent, that may still exist. But there are preventative things. So again, 30 to 50% of cancers in general can actually be prevented. And when we talk about prevention, we're speaking about those things we can actually do. So healthy lifestyles, we talk about no smoking. The alcohol is the worst part for me.
Yeah.
Because even one glass of wine does increase your risk. So on the one hand, we speak about heart health. And on the other hand, the same glass of wine
could do the
can
same.
increase, but the risk exactly. So we choose our
a thin
evils.
line for us,
Yes,
you know.
very thin line. We talk about exercise. We talk about the healthy options when it comes to diet. But no,
Right.
there is no specific food that you're going to eat that's going to prevent you from getting breast cancer.
Right.
Our biggest risk factors are our gender. There's nothing you can do about that.
Right.
And our aging process. So the older we get, the more likely we are to be exposed to more of the environmental things and the changes that happen with our cells. Okay?
That might be conducive for this.
Exactly.
Hi.
So if we knew what caused breast cancer,
Yeah.
then we would know what to tell you to avoid in order to not get breast
Right.
cancer. And then you have those persons who have done everything they're supposed to do. They
Yes.
exercise. We speak about not having children as a risk factor, and that really has to do with your exposure to estrogen, our female hormone, kind of
Okay.
unopposed.
Right.
As well as if you've never breastfed, the thought is that your breast cells only mature when you breastfeed. And so immature breast
Aye.
cells are more at risk for developing breast cancer.
Lord Jesus.
I've seen a few of the posts that obviously say that there is a slightly increased risk, and I need to be specific about that for things like the oral contraceptive pill and hormonal replacement therapy.
Okay.
We need to take everything into context.
Okay.
Medicine is definitely not usually black and white. There's a
Right.
lot of gray.
Yes.
So we have women who need the oral contraceptive pill for other conditions that they may have. We do encourage, or at least educate them, that you might be at a slightly higher risk of developing breast cancer. The good news is that once you stop taking the oral contraceptive pill, your risk goes right back down to what it was before.
Okay.
So if there's a medical reason why you need to be on the pill, or that is the only option that you can use, whether it's for contraception, for really bad acne, for maybe polycystic ovarian syndrome, for maybe like irregular periods or not having a period, we have to weigh the risks and the benefits, and
Yes.
the patient, along with their medical practitioner, make that decision.
Make the decision. Oh, that's cool.
So if you need to be on it, we would advise you to take breaks in between, not every other month and missing pill doses. That's not what I
Yes.
mean by breaks, but scheduled breaks. Likewise, you and I have not gone through menopause as yet. But for those people,
I'm wondering little,
me too, but I wouldn't say that. There are patients, or people, I should say clients, who have really severe symptoms as they go
Right.
through menopause.
Oh.
And sometimes the estrogen or the hormonal therapy makes a huge difference in just their daily activities. Again,
Okay.
we have to weigh the risks and the benefits.
Oh, man.
Okay? So just wanted to
Wow.
qualify that. And then there are other things that we spoke about: genetics, ability to have a baby, the age at which you start having your periods, the age at which you go through menopause, again related to the exposure to your estrogen, your hormones. Okay, that we really have no control over.
Right.
And so if you are doing everything that you should be doing, it doesn't mean you're not going to get breast cancer, but you've done that part
You've done
of
your
it.
part.
And so we couple that, so the preventative, the healthy lifestyles, we couple that with what you should be looking out for and what you should be doing, so that if you do have a cancer, we can diagnose it earlier.
Very really. What are some of the things we can look for?
So the most common is a lump. Okay, so 7 out of 10 people who have breast cancer would have had a lump. And the majority of patients who have a lump, it's a painless lump. So again, I have to qualify that. The majority of people coming into my office have breast pain.
Right.
Okay, that's what gets you to a doctor's office fastest. Your
Yes.
breasts are hurting you. Yes, there's a chance that you can have a painful lump that is cancerous. A lot of times, though, the pain, especially if it's both sides, may be related to your cycle, the
Yeah,
hormones.
yeah.
You could have small cysts or other things which are not breast cancer.
Okay.
We wish that every breast lump was painful because you would come to the doctor. And I say that
Exactly.
every single time that I come
Yeah.
here, and every time that I talk. Because if you're not accustomed to examining your breast, you're not going to know that there's a lump.
Because it's not painful.
Because it's not painful.
Right.
So, and I forgot to bring my little chain that shows the different sizes.
Oh.
So if you are accustomed to doing routine breast examinations, that is at least once a month,
Right.
chances are you will find a lump that's about 1 centimeter, 1 to 2 centimeters. Okay? In medical terms, that is probably stage 1. That is like the earliest breast cancer that you will get.
Right.
For those persons who have been doing, when you reach the appropriate age, doing their mammograms once a year, the size at which you may find an abnormality may be something you may not even be able to feel. It may just be an abnormality on the mammogram.
Right.
Okay? So that's why I, again, advocate for that.
Yes.
For those persons who incidentally, or should I say accidentally, find a lump, it's usually about 4 to 5 centimeters. And that puts you in a stage 2 to stage 3. Okay? So hence why we stress the importance of doing your breast exam. Now, as we were saying, especially for me, as I say to most of my patients, as I get older, it is terrifying, especially with all the
Yeah,
knowledge that you
yes.
have. You're like, please, please, please.
Yeah.
But I would much rather find something small than find something huge.
Huge, yeah.
Okay? Because that is automatically related to your stage, how advanced your treatments are going to be, how long your treatments are going to be, and the cost of your treatments.
Right.
Okay? So earlier breast cancer, usually there is some surgery. Usually there's chemotherapy if you're fit, if you can tolerate the chemotherapy. You may require hormonal therapy based on your type of cancer. But certainly as your cancers get bigger and more advanced, we now have to add things like radiation, which
Right.
costs anywhere from $9,000 to $20,000.
Oh.
You're going to have to leave St. Lucia to go somewhere for 4 to 6 weeks to get and the side effects of all of that. So, and you probably need even more advanced and longer duration of your therapies. So the early diagnosis signs are usually a breast lump. It costs you nothing to do your breast exam yourself. And there's no one way to do it. We would just want you to get accustomed to the texture and the feel of your breast, because most of you visit the doctor once a year. If you're going to wait once a year for somebody else to examine your breast, a lot can happen in that 1 year. Okay? We talk about the change in the shape of the breast. So sometimes, especially if you lean forward, your breasts usually come off your chest wall and fall forward.
Yeah.
You may find that one doesn't do that. It's kind of fixed or stuck onto, or
Oh.
a portion of it. Or you look in the mirror and realize, hey, there's a little bit more asymmetry. Both of my boobies do not look the same. So
Right.
we need to get accustomed to what our normal is. Those of us
yeah.
who breastfed and are right-handed probably fed more on the left side, so we could use our right hand. Sometimes that may contribute to the asymmetry, but some of us may just have breasts that are just not the same size.
Right.
A change in how your nipple looks. So if your nipples are normally poking out and all of a sudden they change and get pulled in,
Pulled in.
you need to see a doctor.
Okay.
Some persons are born with inverted nipples. So no, you did not have breast cancer from then. It's a change in the nipple.
Right.
Part of your breast examination, apart from the breast itself, is actually squeezing the nipples. Okay, so you should be squeezing the nipples to see if there's anything coming out of the little holes that are in the nipple.
Right.
So all of us have about 20 or so holes in our nipple. That's homework for everybody to just go look at your nipples,
Right.
male and female. And those are the pipes that actually take the milk that's in the breast onto the surface so you can breastfeed.
Okay.
So we expect, if you've ever breastfed, that you may have milk. You may continue to produce a little bit of milk,
Okay.
but we're looking for changes in the color of the discharge. So
Oh,
we get
okay.
more concerned if we have a funny color. So if it's green, if it's brown, if it's red. It doesn't mean that it is breast cancer, but certainly something that you need to get
need to
tested.
check. Wow.
Okay?
Interesting.
Under the arm is part of your breast exam. So those of us who shave, wax, etc., you may get small little cuts on the skin.
Right.
The underarm region is where a lot of our glands or lymph nodes reside, and so they're part of our immune system. So they react to anything that's happening. You get a scratch on your chest wall.
Yeah.
If you get a scratch, you'll find that they may get a bit tender. You may feel a little lump. So feeling very mobile, small lymph nodes under the arm does not mean you have breast cancer. But if you're feeling bigger lumps, or if you have a lump in the breast and you have something going on under the arm, you need to see the doctor. Some patients will have nothing in the breast, but something under the arm. Okay? You can have breast cancer and the only symptom you have is a gland under the arm that's enlarged.
Wow.
And you can have breast cancer and have nothing in the breast and have nothing under the arm on physical examination.
Right.
And when you do the mammogram, you may find something.
Oh, boy.
Or we may do some tests. So, for example, you're not feeling well, you're tired all the time, maybe your eyes are getting a little bit yellow. We may do, for example, an ultrasound and see all of these spots on your liver, which suggests that there is a cancer somewhere. And it may actually be your breast and there's nothing in the breast that we can see.
Wow.
Okay? Recently, we've had a couple of patients who had what looked like a small rash on the nipple, which they thought was just something, either bra that was irritating. And it turned out to be a special type of breast cancer called Paget's that affects the nipple, and it's usually just the skin. So for everybody who has, or anybody who may think that it's a rash or just some sort of something going on in the nipple, you should get it checked out.
Okay.
If you're being given medications and it keeps coming back, it's not working, you need to insist that they refer you to a surgeon so that we can get some tissue and test that.
Oh, there's so much happening there. It's already 11 o'clock. Oh my God, we needed the day for you. We needed you for the day. Oh, there's so much going on here. Okay, so let's fast forward now to the Cancer Society. What are some of the things that you have on during this month? What would you like us to walk away with?
So everybody is doing something in October, which I'm very, very grateful for. We are not doing anything that different except trying to create the awareness.
Right.
This month we have coupled with a Creole theme. So everybody knows it's Creole Heritage Month.
Absolutely.
We don't want you to have to choose between pink and madras, so we're asking you to combine the two, and it really is
Pink
a
madras,
beautiful,
why not? It's a beautiful
combination.
Oh, it's lovely.
Yeah. And we've also partnered with the Folk Research Center, so they're helping us because we're having this conversation. I can't speak patois properly, and I know that
Right.
we're missing a whole section of our public that is just not able to participate in this conversation.
That's right.
And so moving forward, again, not just in October, but moving forward, they will be helping us to get that message out there.
Oh, beautiful.
We're also reached out to the creatives. So we've also partnered with Nudge. And we've gotten so much of a good response. We've gotten donations towards our oncology patients from our creatives and their handmade products.
Aw.
So we're going to have a raffle at the end of the month just to be able to gift as many of our cancer patients as possible.
That's lovely.
We've partnered with, so we've gotten things like keychains. We even have secondary
nice.
schoolers who are partnering with us. They're helping to make pillows.
Oh, I love it.
We have Aliyah who is also doing ribbons that she's crocheted or knitted.
Oh,
and
yes,
they're
yes.
really,
I
they're
have
really, really
one, you know,
pretty.
it just didn't go with the outfit.
With
this
the
morning.
outfit.
I have one. I have one of the crochet one. It's so cute. Yeah.
So we're partnering. We have the spas. We have Health and Beauty Spa. We have Purity Day Spa who have donated a spa treatment to one of our patients, and they're going pink. So
Okay.
we really just wanted this year, we've written to as many institutions as possible, the restaurants, the bars, to create a signature drink, a signature meal.
Nice.
Put up our QR codes so that people can visit the website, get the information, but start the conversation. Have the
Absolutely.
conversation.
I know Fashion Block. Susie is very much on. She actually gifted my last patient who was a survivor
yes,
as
I
well.
saw that.
She's normally very on board with this as well. I'm sure if you check her, she might be willing to donate something.
Okay.
So you should give her a
do
call.
that. Put you on the spot here.
No,
But
she
we
will.
really-
She would love it. Honestly, she will.
Yes.
She will do it.
So we're really just creating the awareness, but we want this awareness to continue past October. That's usually
Yes.
the problem. Everybody does everything in October, and then the rest of the year, it's almost like no more cancer
Nothing.
gets
Yes,
diagnosed.
nothing happens.
So we
Not
want
a
you
voice.
to get the information, try to get the correct information, and have the conversation.
Wonderful. Right. Well, in closing, what do you want to leave?
Again, it takes nothing to examine your breast. Prevention wise, we want the young boys and young girls. I went to RC recently and they're like, we don't have breasts. I'm like, yes, you do. So from primary school, it takes nothing. Examine your breast. If you feel something, get it checked out. I think that's the best advice that I can give to you.
Right.
If you're over 45, get your mammogram done.
Right. And from a physician or surgeon standpoint, somebody who may be, well, they've got it and they're out there and they're probably looking for a little means of hope. Want to leave something with
We
them?
have so many survivors. We have thriving survivors. A diagnosis of cancer, a diagnosis of breast cancer is almost like a diagnosis of high blood pressure and diabetes. We have the means to treat you, and if we don't have what you need here, we will find it for you. So do your part and allow us to do our part. But there's so many people out there who are testimony to the successes of their treatments and just living their best lives.
So this is
after
not
breast
an
cancer.
automatic
It
death
is
sentence. So
definitely
don't
not.
die just
Not at
thinking
all.
about it.
Not at all.
You have a lovely person like Doc here who is going to be holding your hand through that process
As much as I can.
as much as you can. Thank you again, Dr.
Thank you for
Remy.
having me. Thank
Oh,
you
it's
to
always a
RCI.
pleasure.
I knew I didn't have to wear pink today
I
because
know.
Mareen is
I
just
turn up and
rocking it.
Listen,
you.
I said hello. We turn it up. We turn it up today. But
Well,
I have
thank
a
you for your
part where you have
support
some
all
very
the time.
unique pins, so I have to try and
Yes.
get some of those. Yeah. And can we get those? Are those on sale? You know,
We do,
always ask.
yes,
So
the Cancer
where can we
Society.
find it from the Cancer
Yes,
Society
you
to
can.
get our little merch and
Definitely.
stuff like that?
Yes.
I had a scarf the last time, so I had a
Exactly.
little
We
waist bag
have.
and a
We
little
have.
waist bag that I normally walk with. So there's quite a number of
We have
things that we can
yes.
support.
No
and-
t-shirts this year, but we have
but we do
lots
have
of
other things.
accessories.
All right, so you guys know what time it is. If you'd like to assist in some way or the other, you could purchase some of the little merchandise, yeah?
Yes.
Paraphernalias. Right, so that's our time. Join us again next Tuesday. We'll be back here again. Another St. Lucian is going to be in our company. Thank you to Dr. Remy again for, allowing us her time because we know she's a busy one. Thank you to the First National Bank, and also thank you to Courts.
It all started with a penny. For over 85 years, we have invested in our farmers, fishermen, people, and our country. When we were called to serve, we were here. We understand what is valuable to our people and our country. That is why we support all industries, including tourism. We are the bridge towards a brighter future and economic growth. When our people, government, and businesses called upon us, we were here. 85 years later, First National Bank St. Lucia Limited is here for you.
Are you ready for the biggest shopping event of the year? Get ready for Quartz Prime Week Mega Sale. Monday, October 16th to Friday, October 20th. Join us for unbeatable deals. Save up to 40% off on all electronics, furniture, and baby products. And save 35% off on all mattresses and 20% off on small appliances and more. But remember, this sale won't last forever. Prime Week is here and for a limited time only. Monday, October 16th to Friday, October 20th. Shop now and pay nothing till January 2024. Don't wait. Don't miss out on Quartz Prime Week Mega Sale. Check in store for details. Quartz, bringing value home.
Neba woy! Makume, mwen sa ou se Che Laos. Mwen se Che Magritte. Tuesday 17th October, se fête Magritte. Mwen ka invite ou. From 10 a.m., church service, St. Joseph the Walker Catholic Church, Grosile. 12:30 p.m., Grand